Worker of the Year, Theresa Schmidt. Theresa Schmidt, Nurse Manager for Bismarck-Burley Public Health, provides clinical oversight to ensure the delivery of comprehensive public health services and programs. Over the past 2 years, Theresa has been determined and dedicated. Her efforts inspired her staff to persevere during challenges of the pandemic. Theresa has put forth an outstanding effort on behalf of local public health. She has demonstrated her leadership skills and ability to collaborate with community partners during this pandemic response. Theresa served as the liaison for the local COVID-19 homeless shelter management between the North Dakota Department of Public Health, the North Dakota Department of Human Services, and the local shelter management provider.
Theresa connected with our community partners to set up some mobile vaccination clinics for underserved populations. What was unique about this effort is she worked with providers in our community to remove barriers for those underserved populations so that they could easily obtain a COVID vaccination or an influenza vaccination on site. Barriers were removed for child care, for transportation, no appointments were needed. Theresa arranged the mobile clinics, gathered the staff together, and we went on site to areas like local food pantries. And people were already there getting their food, getting their basic needs met, and we were able to provide vaccinations on site while they were doing that. So another selfless act of Theresa's is to be sure that people are getting access to health care, and this was a great way to do that for those in our community.
She also served as the lead for the Health Equity Immunization Project to ensure that the most vulnerable populations have access to vaccinations.
Her passion for public health is just extraordinary. She always wants to make sure the community is safe and the best way to protect them, and always looking out for everybody as well as her team as well as the community.
She has worked hard to implement strategies to address barriers to care. She organized a mobile vaccination clinic to reduce these barriers to accessing COVID-19 and influenza vaccinations. This mobile vaccination clinic stopped at food pantries, local homeless shelters, support groups, and even local clothing closets outside of regular clinic hours. This mobile vaccination clinic was a cost-effective model of care that addressed health inequities and increased trust in local public health while serving the community.
She's the reason that I went into nursing. I've been a nurse now for 5 years, and growing up with her, watching how caring and compassionate she is, really made me want to help serve the public as she does. She has worked tirelessly throughout COVID. The last couple of years, she's made sure to be the one to take the after-hour calls so she doesn't have to have her staff do that.
She's always self-sacrificing, doing anything for others, as Amber mentioned, her staff, her employees, taking that role for them so that they don't have to take those calls on the weekends. She spent a lot of weekends, a lot of nights on the phone, on the computer working, starting with contact tracing through drive-through clinics, drive-through testing. A lot of time, a lot of self-sacrifice, a lot of dedication. And not necessarily just because it's the job, because she cared about the outcome in the community.
Theresa has worked tirelessly to ensure community health needs are met throughout this pandemic. Theresa's example of service leadership and dedication to serving the most vulnerable population during the COVID-19 pandemic makes her a valuable member of her community.
I have thought about what sets Theresa apart from all the other leaders in our community, and I've come to the conclusion that Theresa is just the same as all of the rest of us. She's a wife, a mom, a grandma, daughter, friend, sister, nurse, coworker, taxpayer, and so on and so forth. But where she separates herself from the rest is that she shows up each and every day with the drive to be the best human being she can possibly be, and to push down those barriers that create division within our community. Thank you, Theresa, for being that human being that inspires positive change and growth within the public health world. You are a great leader. You are a greater leader than you will ever know. Thank you for being the motivation for greatness.
It's been a huge honor to have been nominated for Public Health Worker of the Year and to receiving this special award from the North Dakota Public Health Association. I think most of us can agree that the past 2 years have been very challenging in our careers and some of the most difficult times we've ever endured. As public health units, we were able to come together and work through the pandemic demands and try and meet the needs of the community. It would be very easy for us to focus on some of the negativity that surrounded the pandemic, but I think we can also look back and find a lot of kindness and camaraderie between each other and our communities. We had people at the very beginning of the pandemic stepping up to show kindness through making masks for people that needed them and donating them. We had individuals come together and volunteer for clinical trials so that we could have vaccine available. And just the sheer kindness that came out from checking on each other, whether it was our friends, our family, or our neighbors, and making sure that everyone was doing okay.